Okay, everybody, let's look at the case of Brittany. So, Brittany is a 35-year-old woman who, let's see, is spoke to her close friend Janie about being upset about the recent breaking up with her boyfriend. So, let's just identify that first as kind of a situational issue, kind of life stress issue. So that's something to consider right off the bat. That's again relationship based. It says that they've been together for about 6 years, so that's quite some time. That's a lengthy relationship. So it's not just something that comes and goes. So that's a pretty good sign that there's been some stability there in her life for 6 years. And it looks like she was even hoping that they would get married soon. So obviously it seems like they had been doing fairly well, or at least she hoped that they were headed on that track. Then this next little statement looks like Brittany blames herself for the breakup. So that's kind of feelings of guilt, blaming herself for what went on. Whether or not that shows kind of inappropriate guilt or maybe insight as to her role or what she feels her role in the breakup is, we will see here. Looks like she stated that she could not help but seek constant reassurance from him that she was good enough and made him happy. So that's a pretty common sign of those who are depressed, of seeking constant reassurance that she was good enough and made him happy. However, there's also other disorders, as we know, that are kind of relationship based, or other disorders that could have that self-doubt, needing reassurance. So let's kind of list those out as far as what we have, maybe some running diagnoses to rule out. So let's rule out, first of all, let's see. So we have a breakup. She blames herself, felt that seeking constant reassurance that she was good enough and made him happy. So there may be some form of depressive disorder going on. We will see as the scenario plays out. As we know, another really kind of relationship-based, seeking reassurance, not being sure if she made him happy. That definitely could be along the lines of a borderline personality. We have to see if that plays out. Usually with borderline personality, again, it's not just about relationships. It's just not about seeking reassurance. Borderline personality is very distinct in having kind of instability in relationships. We see that she's been with him for about 6 years, but we're also talking about emotional kind of turmoil, mood swings, possibly threats of suicide, fear of abandonment or separation from that individual. So borderline is very distinct with regard to a mental health disorder. So, the signs and symptoms really kind of have to be there and that intensity has to be there. But for now, let's put it up there. And then finally, seeking constant reassurance that she's good enough. This phrase could also lend us to consider that there may be some sort of anxiety disorder. For now, those are kind of the big ones that I'm keeping on my radar. So let's continue on. Looks like despite his reassurances, she would comment that he would eventually leave her because she was not happy enough for him. So it appears that he did try to reassure her, but she continued to state that she was not happy enough for him. So that's kind of a curious phrase right there, is that, whether that shows insight or some sort of kind of cynicism. And maybe it is insight. Maybe she just knows that she's just maybe not that type of person. Maybe he's looking for, or maybe he expects or wants somebody with a little bit more energy, a little bit more happiness, and she's kind of realizes that that's necessarily not her. So again, whether it's inappropriate guilt or whether it's her just actually maybe having some insight into long-standing patterns. Let's take a look. It looks like she constantly spoke about not having enough energy to do much, and she worried she was becoming overweight because of the constant snacking she was doing at night. So let's see, not having enough energy to do much, so kind of the lack of energy, potentially the lack of motivation, that certainly is consistent with depression. Worry, so we have some anxiety as well as with depression. She's worried about becoming overweight. So so we have kind of anxiety going on, but we also have worry about becoming overweight. So it seems like she's been eating more, snacking more, increased appetite, or she's been doing that maybe for a while. So this also speaks to potentially more signs of depression and maybe some more signs of anxiety. Let's continue on. It appears that she's an accomplished engineer at a large corporation. So, I mean, I think that kind of lets us know that she's been able to hold a job. She's been able to get an education. Must be pretty intelligent, functioning to be able to be an accomplished engineer. So, again, good for her in that regard, and being able to function at that level despite kind of what seems to be potentially kind of a longer standing or dealing with depression and potentially anxiety. It says here, however, she has always felt inadequate about herself, especially in relationships. So this key word right here, always. So that gives us a timeline that she has always felt inadequate about herself. So that lets us know that this is the chronicity of this. It seems like a chronic kind of long-standing symptomology, that if she has always felt inadequate about herself, that this may go back to even adolescence, and again speak to a chronic nature of the issue. So that's something to consider, that if it is a depressive disorder, it could potentially be major depressive disorder. The chronic nature of it could even speak to persistent depressive disorder or dysthymia. So that's also something to consider as well. Okay, let's continue on. Let's see. Brittany describes feeling blue most of her life and was often teased by others as being a Debbie Downer because of pessimism and hopelessness about the future. So interestingly enough, in this scenario, that gives us a real kind of tips our hat a little bit in a certain direction when she says that she's feeling blue most of her life. So a person who's really felt down most of her life, and then has always been kind of known as a person who's been kind of pessimistic and has a hopeless outlook for the future, that really speaks to and could speak more towards this persistent depressive disorder. You think of the character on Winnie the Pooh, you think of Eeyore, who's just kind of gray and blue and kind of going through life and pretty pessimistic and hopeless. This goes along with her previous phrase that she's always felt inadequate about herself, so that kind of matches up. I'm kind of actually leaning towards this has been a long-standing issue with her and that she's been blue. So let's figure out this last portion. It looks like she frequently works through her sadness by dedicating herself to her work projects, although she's been known to become irritated at coworkers for their lack of effort. So again, this long-standing, she works through her sadness. So she's kind of found a way to cope through all these years of working through it and just kind of pushing through, although it looks like she does become irritated and has that irritability factor as part of this kind of constant kind of down blue mood. And then finally this last, looks like Brittany states that she's never been suicidal, so that's certainly key, and has had no history of major depression. So this last line is the kind of the kicker, is that no major depression, and has never been suicidal. So it really has never reached this point of a major depressive episode, or has never, admitted to it. Even currently, it states that she's never been suicidal. Now, we don't know if that's the current case, but it doesn't say she is, that she's suicidal despite recently breaking up with her boyfriend of 6 years. So, which is, again, kind of curious of whether she just, that's part of her long-standing depression, as she kind of figures that these things will happen. So let's talk about diagnoses. I would say that the borderline personality disorder never really did play out. She's never been suicidal. It really never spoke to instability or marked instability in relationships or mood. It looks like she's always just kind of been the downside. So I'd rule out borderline personality, even though it is kind of a long-standing disorder. Obviously, it just didn't play out here in this scenario. Certainly anxiety as a potential kind of symptomology or disorder to keep an eye on. Certainly there's elements of anxiety, such as worry, feeling inadequate about herself, needing reassurance. So those are elements of anxiety. I don't know if it extends to kind of a generalized anxiety disorder. Certainly it's been a long-standing pattern, but this, at least this particular scenario, doesn't speak a whole lot to anxiety, although there are some elements sprinkled in there. So the anxiety portion is something, though, that certainly some traits or symptoms that likely we will incorporate into counseling, or incorporate into our treatment as part of kind of her symptomology. The anxiety certainly is there. It's maybe just not kind of a generalized, overwhelming anxiety. So finally, I think if anything, she could be experiencing maybe a depressed mood, and that might be something to rule out. So let's put it this way. Here's what I'm going to do. Because the long-standing pattern of feeling blue, it's been most of her life, pessimism, hopeless about the future. She's never been suicidal, never had a major depression. So I'm pretty confident, at least for now, that we put persistent depressive disorder. However, what would be interesting is to give her a PHQ-9 by chance and just see where she's at with major depression. Who knows? Especially with this recent breakup and all these recent ways that she's been talking. It may be that she, if anything, it may bring on that she's suffering from some sort of mild major depressive episode, which in that case would be her first single episode in her life. Which, on top of this, so what we do know is if a person that has persistent depressive disorder, so I'm going to kind of mark that as our key diagnosis here. But if a person has a major depressive disorder kind of superimposed upon a persistent depressive disorder, we actually, in clinical terms, we call that double depression. And that is, within the DSM, that is permitted to happen, is that a person who has a long-standing pattern and yet then has a major depressive episode on top of that certainly is permissible. But right now we just don't know. It doesn't speak to her being suicidal or really having a major depressive episode at this point. Also, what's concerning to me is a long-standing pattern of feeling down, potentially lacking energy, gaining weight. So I would have, as far as a treatment plan, I would do a referral. So referral to PCP. This might be a candidate for, checking, doing all sorts of a medical workup to see especially like hypothyroidism, stuff like that. There may be the weight gain, the irritability, the lack of energy and motivation, metabolism issues. So certainly I would refer her to her PCP for a medical exam, even potentially medication, maybe even a med eval, depending on kind of the primary care doctor, see what he says about that. And then as far as treatment goes, typically with persistent depressive disorder, dysthymia, those folks really do well with like person-centered approach, Rogerian approach, just to be able to, because they've had this long-standing pattern of being blue, usually developing a relationship and starting to really be person-centered and strengths-based is a great approach. Some CBT-based therapies could probably do very well, especially with some of the thinking errors going on and the self-doubt, and maybe kind of some education, psychoed about relationships, relationship building. So that would be appropriate, I think, as well as far as treatment goes. And when we come to the DSM, persistent depressive disorder, it appears that we need to also look at, so at this point we just don't know if a major depressive disorder is happening. So in that case, we don't necessarily need to put the other specifiers on the major depressive disorder. But if we did, let's just say we did, let's say we gave her a PHQ-9, it came back that she was in the midst of a major depressive disorder. I'm looking at the DSM here, DSM-5-TR on page 193. I would probably put that it's a single episode with anxious distress, maybe because of the anxiety, the inadequacy, the irritability. So that might qualify her for anxious distress. I would also put that this is kind of a late onset single episode of major depression, certainly after age 21, would be very appropriate in this case here. Let's see, what else do I want to put? And then it says here, specify for most recent 2 years of persistent depressive disorder. I would say with pure dysthymic syndrome, meaning the full criteria for major depression has not been met in at least the 2 preceding years. So that probably is the best case, is that this is what they would call pure dysthymic. Syndrome. So if this were a single episode, I would do that, kind of with anxious distress, late onset, with pure dysthymic syndrome as being the case, and that she really hasn't had any intermittent major depressive episodes. And then lastly, I know there's a lot going on. Lastly, I would put this as a case, if I were to do a specifier for a major depressive episode, in this case, I would do mild. Because of the fact she's still working, it doesn't really show she's not suicidal, she's still functioning, she's just been blue and down, and it's likely, like I said, a mild major depressive episode if that's the case. If she is having a major depressive episode, that would be the primary diagnosis at this point in time, because it is kind of takes precedence over the persistent depressive disorder. So if it is a single episode, major depression with all those specifiers, you would put that first. You would begin to treat her. I would refer her to her PCP. It would be considered double depression because it's on top of her persistent depressive disorder. Once the single episode lets up and goes into maybe partial remission, then you return to treating kind of the persistent depressive disorder as the long-standing syndrome with, I would say, CBT, Rogerian type of approach. So this would be in possibly medication for her because it's been so long-standing. So this would be the case of Brittany. I think this is probably the best approach and diagnosis for this case.